So my name is Benito, and I'm an oral maxillofacial surgeon with a dental and a medical background, and I have specialized in cleft and craniofacial surgery, in pediatric cleft and craniofacial surgery. So 1 in 500 to 700 babies is born with a cleft of the lip or the palate. And formerly we did conventional impressions, and these conventional impressions might be easy in adults, but in a newborn baby it's a bit more tricky and also sometimes dangerous. Actually, this was a clinical driven or a clinical problem we have, and we needed a solution. And we wanted to see whether the intraoral scanners could help us in overcoming the limitations or the dangers also of these conventional impressions. If you think that it's a benefit for your patient, and you should get first in touch with it, and once you start, actually we never went back to conventional impressions again.